So joining me now to wade through the decision we all need to make about whether or when to get another dose, infectious diseases specialist Dr. Zain Chagla joining me now. So Dr. Chagla, first things first, for anyone who doesn't even have that third dose, maybe they just have two, what's the quick advice there and why?
Yeah, absolutely. If you have not, gotten your third dose, particularly if you've not had Omicron or another infection to date, it is important to get that third dose. It solidifies the immune response, it makes things much more broad, and again, is a better protection than having two doses alone. That's good for most populations.
And what do we know about how important / effective the fourth dose, the second booster, may be?
So we do have data from Israel where it was given predominantly to older individuals and then to younger individuals. In those older individuals, over 60, those with immunocompromising condition, it took the relatively low rate of severe disease and made it lower. So there was benefit in those populations, and those are populations that end up in hospital. That's where the recommendations right now in Canada are, and those people should be getting their fourth dose. When it came to preventing infections, though, in that group over 60, and even in young healthcare workers, the prevention of infection actually dropped off relatively quickly. In some sets, 4 weeks, in some sets, 8 weeks. And so as a measure to reduce transmission or reduce the risk of someone being infected, it may work, but it is a very short time that's giving any benefit.
Okay, so for those of us who are in the 18-plus demo for whom, the option to get a fourth dose is starting to open up depending on which province you're in, what's the starting point to make that decision about whether or when to get the shot? Like, for example, when you most recently got your last booster or when you got sick? I guess that's one starting point.
Yeah, so look, people who have had Omicron have pretty good protection against reinfection. We have data from Qatar that shows that. They have very good protection, especially if they had 3 doses in Omicron, from getting severe disease. And so there's good data around that. And so again, you really have to start thinking about personal protection. Are they in a risk group? Do they have medical conditions that are severe enough that if they get a breakthrough infection, lead them to hospital, which is rare in the age group of 60 and under, but everyone has their personal health conditions. And you want to make sure if you're going to make that decision, it should be a fairly decent time away from either your last Omicron or your last infection or last booster, as you're probably going to get a better response the longer it's been.
Well, and knowing that the fall may bring a more serious spike in COVID outbreaks than we might see during the summer, just by virtue of the fact that more people are indoors, should people be trying to play with the timing there? So delay getting the fourth dose until then?
Yeah, this is where NACI's guidance came out. Look, we know during respiratory season, November to March, there is going to be more transmission just from the fact that we're indoors, there's more close contacts, there's more shared air. And again, this is where we see transmission ongoing. And so if you're looking for the vaccine to really optimize immunity and really get the longest stretch out of it, having it in the wintertime may make sense because of the fact you have to last through the winter with as much protection as possible. So, there is that consideration there to consider it in the fall and winter like we would with the influenza vaccine campaign.
Very quickly, is it worth waiting for either a more precise, more effective, more Omicron subvariant specific vaccine? Is that in the cards for the fall?
Yeah, so, these vaccines are probably going to come to the market. They do show in individuals as their fourth dose having antibody levels that are much higher than the original COVID vaccine. And so, there may be some benefit here, not only from waiting to the fall for the seasonal component, but also waiting to see what, again, comes down the pipeline in terms of what this vaccine could do. It may not reset the immunity to the way it was at the beginning of the vaccination era, but you may get more bang out of the buck for it, down the line, in the sense that you will get more protection long term. So it is worth it to see, and again, worth it to continue monitoring for that efficacy data as it's coming out.
Okay, Dr. Chagla, always good to get your guidance. Thank you so much.
No problem. All the best.